So, Dr. Richter is a well-known veterinarian. He graduated from the University of Florida with honors. He's the founder of the Holistic Veterinary Care. He has 2 locations for his clinics. His clinics have received more than 30 awards, so that's pretty impressive. He was named top 10 veterinarian in 2012. And if that wasn't good enough, he was named America's favorite veterinarian in 2015. So I don't know where he goes from there. Apparently, I think that's the top. That's the best you can do because he hasn't gotten any other awards like that since then. I don't know if it'd be universe or whatever, or world, international. I don't know. But anyways, that's really quite amazing. He's the author of some best-selling books. Actually, he mentioned a few of them. I have one here, The Ultimate Pet Health Guide. He didn't mention that one, but that's a great book. And anyways, when I think about Dr. Richter, what 3 characteristics come to mind? You guys guess. I'll give you a second. What would you think? What characteristics, what kind of character does he have? What would he be known for? When you see him, when you engage with him, when you talk to him, what would it be? Here's what I had. Be they right or wrong, I don't know. Humble. He's always been very willing, more than willing, to help me engage with something like this, even though I'm a nobody. And he's just a humble seeming guy. He's generous with his time, like I said, helping and being willing to do things. He's generous with that time, which is your most valuable commodity. And then just a gentle guy. Seems like a veterinarian that I would love to have for my dogs. Of course, we live in Michigan. He's on the West Coast, so that doesn't work. But anyways, those are the 3 things I noted, and I'm very thankful for Dr. Richter and for his participation here and for what he means to the veterinary community.
As I say, we're going to talk about longevity science for pets, and let's kind of begin with the conversation of how we define longevity. And I think as a veterinarian, I might have a slightly different definition than you do as a pet owner, but from a longevity perspective, we're looking at clearly quantity of life, how long our pets live as a primary parameter, but we're also, of course, looking at quality of life. How well are they living? And then, there's sort of this underlying question of is age and aging actually a disease process? And is it something that medically speaking, we should be trying to cure or trying to slow down? And that's, that's kind of a sort of an age old question that I think is really worth looking at. When we don't really hesitate when our pets or ourselves get illnesses from the standpoint of heart disease, cancer, kidney disease, what have you. Nobody would hesitate to treat those. But, in the broader sense, aging, that becomes a little bit of a different question. But let's talk for a moment about what aging actually is. And really the beginning of that conversation goes back to 2013 with a paper that was published called The Hallmarks of Aging. And this was a seminal research paper that looked at the very specific cellular and metabolic things that happens in our body, in our pet's body, in the bodies of all living things that lead to aging. And I'm not going to go through all of these various components because we really just don't have time for it in the short time that we have today. But what I want you to see is that there are very specific things that happen within our cells and within our body that ultimately lead to things in the body breaking down, not functioning as well as they should, and ultimately leading to aging. And at the end result of that, of course, is death. So now that we know what these specific processes are, now we can start to look at ways to intervene and either interrupt those processes, slow those processes, or even in some cases, reverse those processes. So when I look at aging, I look at more specifically, when I look at how to approach aging from a medical and a therapeutic perspective, I look at it as a pyramid. And we're going to go through all of the levels of these pyramids, but the bottom of the pyramid, the base, the foundation is nutrition. And then we're going to move into things like exercise and lifestyle, medical care, supplements, drugs and medical therapies. And what I want you to keep in mind as we go through all of these things is we have to start at the bottom. We have to start with the foundation and work our way upwards. We can't just go straight to drugs and medical therapies and think that we're going to make a significant difference helping ourselves or our pets live longer. The bottom line is you can't medicate away a bad diet. You can't medicate away an unhealthy lifestyle. These things have to exist as a foundation in order for us to get further down the road from longevity. So let's really talk about the foundation of the pyramid, if you will, which of course is nutrition. So to me, this is the lowest hanging fruit in veterinary medicine and animal healthcare, and the thing that the vast majority of pet owners are probably not doing as optimally as they should to the benefit of their pets. So realistically speaking, what options are there from a food perspective? There's kibble, there's canned, there's fresh whole food diets. So I think we all know from our own health and our own wellness, it's generally speaking common sense that the more fresh whole foods we eat, the healthier that we are. The less processed foods we eat, the healthier we tend to be. The exact same thing is true for our pets. However, most people feed their pets kibble or canned food, which by definition are highly processed foods and bring with them all of the baggage and all of the potential health problems that highly processed foods do for us. And in fact, even more so. So, and what I mean by that is when dry food and canned food is manufactured, think about it this way. If you're going to take a fresh food ingredients, and you are going to make them shelf stable for 2 years or more, you have to do things to those ingredients. And generally speaking, what you're doing to those ingredients is not to the benefit of your pet, or in the case of human food, for yourself. Particularly, two of the things that tend to happen when food is processed at very high temperatures and very high pressures, as it is with kibble and canned diets, you get two chemical components that are created in this process: Maillard reaction products and advanced glycation end products. And it's not important to get into the details of what those are, except to know that both of these chemical compounds are very well known to promote inflammation, to cause medical problems, and they can even promote cancer. And here's the thing that is really upsetting for me as a veterinarian, and hopefully for you as a pet owner. If your dog or cat is eating a kibble or a canned diet on a regular basis, then your dog or cat is getting 122 times Maillard reaction products than you likely are on a daily basis, and 38 times more advanced glycation end products than you are. So these little tiny animals are getting dramatically more of these pro-inflammatory, pro-cancer compounds than we humans are on a day-to-day basis. And then we all scratch our heads and we wonder why they age quickly and they get cancer and they get heart disease and kidney disease and all the things that happen with our pets. Well, a lot of it starts from food. So if you don't take anything else home from this relatively quick discussion, take home that feeding your pet a fresh whole food diet is critically important to their health and their longevity. Now, there's also questions about how much to feed, how often to feed, calorie restriction. We don't really have too much time to get into that specifically, except to say that overfeeding is a real problem, just as it is in people. If you are giving the body more calories than it needs, then you are actually, statistically speaking, shortening your pet's lifespan, shortening your own lifespan. So you want to give the body exactly what it needs to survive and thrive, but not any extra. Let's go ahead and move up the pyramid a little bit into exercise and lifestyle. How much exercise is right? Well, we know from the research that lifespan in animals is directly correlated to body condition score. If your pet is overweight, statistically speaking, they are not going to live as long. We also know from a lifestyle perspective that elevated levels of fear and anxiety have negative impacts on the lifespan of dogs and almost certainly cats as well. So it seems like a trivial thing, but making sure that your pet is getting the right exercise and is living a, relatively speaking, stress-free lifestyle is going to promote health and longevity in them. And lo and behold, it does the same for us. And you're probably aware of the fact that statistically speaking, pet owners live longer than non-pet owners. And there's a lot of reasons for that, but it's about us having that companionship and us having something to care for and something to take care of. It is a very symbiotic relationship with our pets. And it's really, really important that we take the best possible care of them, not only for their health and well-being, but also for ours. Let's move up the pyramid a little bit. Modern veterinary practice is a beautiful thing from a healthcare perspective. However, it can also potentially be detrimental when things are not done at the appropriate time or in the appropriate way. And, I'm just going to go through a few things here. Vaccinations. So vaccines unquestionably save lives. However, over-vaccination can be very detrimental to health. Spaying and neutering, in my opinion, is a very, very good idea for most animals, although there are potentially exceptions to that. But spaying and neutering animals too early can be potentially detrimental to their health. Antibiotics clearly save lives. However, indiscriminate use of antibiotics can lead to all kinds of medical problems. We know that oral health is critical to long and healthy lives, both in animals and in people, yet most people don't do much on a day-to-day basis for the oral health of their pets. Preventative care, when we're talking about modern veterinary medicine and frankly, modern medicine in general, with the exception of vaccinations, the paradigm of Western medicine doesn't really do much as far as preventative care goes, but preventing illness is always going to be easier than treating illness. So this requires us as pet owners to be proactive with preventative care. And then, along those same lines, the question becomes, when is medical intervention appropriate? And that is very much an individualized medicine situation. But generally speaking, earlier intervention is better. Treating disease at its earliest possible stages leads to better outcomes. Waiting until the house is on fire is, generally speaking, not a good plan from a health and wellness and longevity perspective. So this is very much where individualized medical practice comes in, and also where integrative and holistic medicine comes in. So it's really important that you as a pet owner think about this of, what are you doing proactively to take care of your pet? I know they may look healthy and happy today, but you don't want to wait until they're sick before you take action to keep them healthy and happy. Let's talk about diagnostic testing a little bit. Again, in the sense of diagnosing problems early, that means we have to look. The thing about animals is I always tell my clients that dogs and cats are 100% honest with one exception, and that exception is their own health. A dog or a cat that looks sick or injured in the wild is going to get eaten by a predator. And therefore, they are hardwired to make everything look like it's fine, even when it's not. So your pet will be 100% honest with you, with the exception that they will lie to you when it comes to their health care. And they will try and make everything look fine, even when they don't feel well, which means we have to be proactive in figuring out if there's something going on with them. And one way to do that is to do laboratory testing to find out if there's something going on. So clearly, I'm sure you're familiar with the sort of standard laboratory test that your veterinarian will run: a CBC, a chemistry, maybe take some x-rays, do an abdominal ultrasound, and all of those are great screening tests, and I am a very big fan. But we can take it further than that. There are additional tests that can be run to look for things that can directly promote health and longevity. Vitamin and mineral levels, such as B12 and vitamin D. Vitamin D has a huge impact on longevity, on cancer rates, on immunity, and this is something that is not routinely tested. Magnesium is one of those sort of mundane minerals that can have an enormous amount to do with muscle health and with immune system health and with maintaining an appropriate body weight. So, if your pet is having some issues weight-wise, it could be a magnesium issue in addition to what they might be eating. We can look at inflammatory markers. We can look at their microbiome. So we can look at what spectrum of bacteria are living in their gut and start to make a determination if things need to be changed. We can look and see if they have food sensitivities that are causing inflammation. We can test for specific genetic markers to see if our animals have predispositions to specific diseases. So, for example, if I know that my dog is predisposed to, say, heart disease, it's not necessarily something that I can prevent completely, but it's something that I know I have to look out for. And it allows me to take the earliest possible intervention if there are problems. We can look at things like DNA methylation, which is a way to get an idea of how quickly our pets are aging. We can also look at telomere length, which again is a means by which of looking at how our pets are aging and how our longevity and health and wellness interventions are helping to see if these animals are starting to age slower. We can look at supplementation. Everybody's familiar with supplements for pets, but you might not have known that there are strategies of supplementation for pets that are very specifically geared towards longevity. This list here is a very incomplete list. I just put some of the big players on this list. I'm going to give you a resource when we get to the end of this presentation on where to get a much, much more comprehensive list and a much, much more comprehensive idea of how to approach longevity for your pets. But you've probably heard of most of these supplements: CoQ10, curcumin, essential fatty acids like fish oil. In my opinion, essential fatty acids are probably one of two supplements that every animal could benefit from. There are so many potential benefits to essential fatty acids. We don't even have time to go into just those, never mind the rest of these. Fisetin is a supplement you might not have heard of, but it has some very specific longevity promoting effects. And when used properly and intermittently, these can be incredibly beneficial. And I just want to be clear here. I'm not suggesting that you give these particular supplements to your pet every day. What I'm suggesting is that these supplements be part of a bigger picture longevity strategy. And in many cases, you wind up wanting to give some supplements at one particular time and rotate through different ones. This is a whole, it's a whole process and a whole strategy that we want to implement to help keep our pets living longer. Probiotics, along with essential fatty acids, are the two things that I think all animals will benefit from. Resveratrol, you may have heard of. That is the thing that is in red wine that is longevity promoting. Resveratrol is an incredibly potent supplement to help promote health and longevity. And another one you might not have heard of is sulforaphane. This is the active ingredient in cruciferous vegetables like broccoli that has anti-cancer properties. It also has a lot of longevity promoting properties. So again, just giving you an overview of some of the more interesting supplements out there. There are a lot more of them, and a real comprehensive discussion about longevity strategies will take a fair bit longer than we have today. But I just want you to get an idea that this is out there for you, and this is something that you can investigate and you can learn more about if you are interested in longevity for your pets. Moving on, as we move higher in the pyramid, we can look at drugs and medical therapies that promote longevity. Hyperbaric oxygen, ozone, of course, really the kind of the cornerstone of the discussion today. Ozone has incredible benefits as far as promoting longevity. It supports the immune system. It has antimicrobial properties. It just helps the body heal. It helps the body's natural production of antioxidants. There are a long, long list of the hallmarks of longevity that ozone can promote. So I just want to bring this up in the context of, I know a lot of the discussion today regarding ozone is about treating specific medical problems, and Lord knows it is great for that. I use it in my office all the time. But I want you to think of ozone also as a means by which you can keep your pet healthy and keep them living longer and healthier, for a very, very long time. Other drugs and medical therapies, PRP, platelet-rich plasma, stem cell therapy, Really, really great potential longevity benefits there. Microbiome restorative therapy or fecal transplants. Fecal transplants support the immune system. They regulate gut health. Gut health is the cornerstone of immune system health and thus the cornerstone of longevity. Rapamycin is a medication that you may or may not have heard of. It is a drug that is getting a lot of attention in the longevity community right now. It inhibits a particular molecular process called mTOR, which again we don't really have time to get into today. But that is one of these processes that, when manipulated properly, can have a significant impact on longevity. You may or may not be familiar with medications called peptides. Peptides are fragments of proteins. They're basically strings of amino acids. And peptides are what the body uses as signaling compounds. So what happens is organs in your body secrete peptides. They get into the bloodstream and they basically signal other cells in your body to do certain things that the body needs it to do. Well, as it turns out, we can utilize peptides to promote things like tissue healing and repair, growth hormone release, building muscle, supporting the immune system. There is a very, very long list of peptides out there. Peptides are gaining a lot of use on the human side as far as longevity therapy goes. We're really just starting to explore these things on the veterinary end, but I just want you to be aware of them because, again, you're going to see more about these sorts of things. So, you got to hear about it first sometime, so it might as well be today. One of the things that you're going to find is, now that we've had this conversation about longevity science and longevity medicine, you're going to see it pop up everywhere. It is incredibly, incredibly fast-moving, cutting-edge research. Clearly, most of it is being looked at on the human side of things. But, for me as a veterinarian, one of the things that I kind of personally find a little bit annoying is veterinary medicine is often sort of following in the footsteps of human medicine by anywhere between 10 and 30 or 40 years behind in technology. Because longevity science is so new, this is our opportunity as veterinary professionals and pet owners to get on board on day one, so we don't have to wait decades in order for us to start taking advantage of these things. We can start doing it now, and in fact, we can start doing it even before a lot of people are taking advantage of it. And the last thing I just really want to bring up here is at-home patient monitoring. So many of you may own devices like an Apple Watch, a Fitbit, something to that effect. And if you own one, then you know some of the benefits that you get from these things. You know how many calories that you're burning. You know how well you're sleeping, how well you're resting. You may be getting some information as far as like what your anxiety levels are, what your stress levels are. Well, devices like these are being developed for pets right now. And remember, I mentioned earlier that the thing about animals is they are not going to tell you when there's something wrong with them. And by the time they look sick, they've probably been sick for a long time. And then we're all behind the eight ball from the standpoint of treatment options. Well, if we have a monitor on our pets, if we, something akin to an Apple Watch, although sadly an Apple Watch will not work on a dog, but if we have some technology akin to that, what we're going to be able to do is get the earliest possible warning to allow us to intervene when something may be going wrong with our pets. So again, these are not quite out right now. I'm actually actively involved in the development of some of these products. So, watch this space. You will see these things become available in the next year or two. And when you do, I highly, highly recommend that you look into these things if you are interested in being proactive about your pet's healthcare. So let's just kind of go back to the pyramid again. Hopefully you can see at this point where we're going with this and why it's so important that we start at the bottom. Again, you can do all the biometric monitoring you want, and you can treat with ozone and stem cell therapy and all kinds of fancy things. But if your dog or your cat is eating a poor diet, then you're building a house on a foundation of sand. We have to start at the bottom and work our way up. And the great news is that for you as a pet owner, you don't need me as a veterinarian. You don't need veterinary care to feed your pet better, to make sure that they're getting the right exercise and the right lifestyle that they need to be healthy and happy. And that is the two base foundations of the pyramid. You can do an enormous amount before you spend a dime with your veterinarian to keep your pet healthy and happy. So this is not about, oh my God, I have to spend thousands of dollars on fancy treatments to keep my pet healthy longer. Now, that is absolutely out there for you as an option. And I think that there are some very, very good options out there for people who are able to do it. But don't feel like this is completely out of your control if that's not something that you can do right now. Focus on nutrition and exercise and lifestyle, and you will have an enormous impact on your pet's health and longevity. So I told you I was going to give you a resource for more information. I have two books that just came out literally about 2 weeks ago: Longevity for Cats and Longevity for Dogs. These are a much, much more detailed discussion of what we just talked about in a very short 25 minutes. Longevity for Dogs and Longevity for Cats, you can buy them anywhere where books are sold. I would certainly encourage you to support your local bookstore, but they are also available on Amazon. There is a print version, there is an electronic version, there is even an audio version. So there is a version for you out there, whatever works best in your life. And if you are interested in learning a little bit more, I would encourage you to go to drgaryrichter.com. You'll get some more information about me and the books. If you happen to live in the San Francisco Bay Area and you're interested in bringing your pet in, my clinic website is holisticvetcare.com. And I do have a line of fresh whole food foods and supplements for dogs and cats, which you can find at ultimatepetnutrition.com. So I just want to leave you with hopefully with some good resources on how you can take the best possible care of your pet, not only to keep them healthy today, but to promote their longevity so you get to stay with them and be with them, and you can enjoy each other's company for years and years to come. And I think I'll leave it at that. And if anybody has any questions, we will go ahead, and I think we have a few minutes to address those now. So thank you so much for your time, and I hope this was interesting for you.
Doctor,
do you prefer raw food? You know what? I think that there's a lot to be said for both raw food and cooked diets. I think it really depends on the individual. Some animals do better on one versus the other. I think lightly cooked or raw, or even a freeze-dried raw, any of those can be fine. It's just a question of what works best for you. Do I use IV vitamin C protocols? I do not actually do IV vitamin C in my office. I do think that there's a lot of benefit in certain conditions. So if you feel like that is something that is that may be beneficial for your pet, I would absolutely recommend that you look into that. Let's see. Do you inject peptides into the bloodstream? Not directly from the standpoint of like intravenous injections. More often than not, they're given either subcutaneously or some peptides are taken orally. So it just depends on the peptide and what you're looking for it to do. So for example, some peptides, if you're looking to treat gut health, then you would give them orally. But if you're looking for more, to support tissue healing and whatnot, you might give them injectively. And then one last question. Oh, not really the last, but other questions. Best way to use ozone at home post stem cell or PRP injections. I mean, if you're doing ozone at home post stem cell or PRP, I would say either rectal or subcutaneous, whatever you feel like is easiest. I might consider doing that for several days post stem cell or PRP, just to really help support the whole process. Let's see. What lab do I use for genetic markers, telomeres, and microbiome? Genetic markers, right now I find that Embark offers a very good panel. Microbiome testing, I like Animal Biome. That's a very good company. Telomere testing, there's been some flux in the laboratories right now, so I really don't have one immediately to recommend, but that should get sorted out relatively quickly. Let's see what else. There's another question about IV vitamin C, which again I do think can be very beneficial, particularly for animals with cancer. Again, it is not a cure-all by any stretch, nor is anything else, but it can be very beneficial. Um, uh, and then somebody here is asking about their dog with a transitional cell carcinoma and kidney disease. Um, uh, that's a complicated question to answer, Kesha. Generally speaking, the way that I approach these things is with a combination of fresh food diet, of herbs, of supplements, of things like ozone therapy, like UVBI, or even potentially a direct bladder infusion with ozone is something that can be beneficial. So there are a lot of potential options here. I know that Jonathan's having a tough time getting on, but I do think that I'm out of time, so I'm going to try not to run over and screw up his whole agenda here. So I will say thank you to everybody, and may you all have a wonderful day. And here's to longevity for us and our pets.